I mean, which is why I think this is a great topic. We're talking about why the clinic setting fails chronic diseases, right? This is why even with the best of functional medicine, naturopathic medicine, and even with hour-long visits with clients, there's financial constraints of them paying for that, insurance not compensating for that, first of all. Second of all, even in those visits, how can in 4 visits over 6 months, we teach all those concepts to each person?
Podcasting from the base of Lake Tahoe in the eastern Sierras comes the Medicine Wheel. We are a group of progressive physicians seeking solutions and enlightenment while surfing the seas of big data and summiting mountains of research in an effort to make the practice of medicine more personal and medical knowledge more accessible, and empower you, the listener, to be as healthy as possible. Now, the Medicine Wheel.
Good afternoon, morning, evening, wherever you may be watching the Medicine Wheel. This is Dr. Robert Floyd. I have a very special guest, someone I met at a functional medicine conference in Seattle, and we immediately hit it off, possibly because she's a wise ass, but she's really fun and really smart, and she laughs and laughs and laughs, and she brought a lot of great energy to the table, and I said to myself when I met her, I said, wow, we got to get her on the show. Please welcome Dr. Maggie Yu. She is a functional medicine physician as well as an online autoimmune coach, mentor, program director. Welcome, Maggie.
Hey, Robert, thanks. Just to give you guys that little background is I've been a family physician for 23, 24 years, but the last 12, 13 years has been focusing on autoimmune disease once I got it, and have received a lot of training in alternative therapies, naturopathic, herbal medicine, around autoimmunity, and it's linked with so many different things. But that being said, I have an online program which is Transform with Dr. Maggie Yu M.D, and it's teaching people in an online group coaching program how to transform their autoimmune disease naturally.
Excellent. Yeah, talking to you about that, it was sounded like a very, very interesting program. And it seems like it's really helping a lot of different people. And people who can't really get to you, they live in a different country or a different city, different state. And it seems like this may be kind of the wave of the future of medicine. Before the podcast, we were just talking about the limitations of the clinic setting. Why don't you give us a little bit more thought on your thoughts of the limitations on the clinic?
Well, you and I have been practicing physicians for a long time. And a lot of people in the podcast, listening to this podcast or seeing this video audience, are receiving care, but don't really see the back end, the insider's view of this. And I think you and I have a unique insider's view to this, because I think we're so used to receiving care and delivering care in a clinic setting. And what people don't realize, and a lot of people do already, is that in the conventional regular doctor route, doctors are compensated by the volume, the number of people that they can churn through a clinic setting. So it's not unusual for a primary care doctor to see 16 to 30 people a day. And if you calculate the number of minutes that is, I mean, we literally sometimes get less than 10 minutes with a patient, maybe 20 if we're lucky. And then we're stuck for the next rest of the day for the next maybe 4 to 5 hours documenting so that insurance will even compensate us for that. So the model itself lends itself really well to what I call episodic acute care, meaning, hey, you got a broken arm, you got an eye infection, cool, come in for some drops, get, you're in and out. That's perfect, right? For like a 15, 10-minute, 5-minute visit. That's what our system is built for, and we're compensating doctors on that. And then you think about someone that, Robert, you and I see some of these more complex diseases, chronic disease. We're talking like autoimmune diseases, multiple sclerosis, diabetes, MS, fibromyalgia, mystery illnesses, irritable bowel syndrome. How the heck, when something like that, that's really complex, which has, you and I know, 10, 20 root causes, how can that possibly ever be dealt with in a 10, 15, 20-minute clinic setting in doctors who have no training in looking deeper?
It's impossible, yeah.
It literally is impossible. And so it's well-meaning doctors. I mean, what school did you train at, Robert?
I went to University of the Americas. So I had to think about that for a second. It's a long time ago. Medical University of the Americas on an island called Nevis in the West Indies.
Yeah. So, I went to UCLA, you look at all these different medical schools, right? And how do we train doctors is we train them to actually basically be on this conveyor belt of factory medicine that delivers 10, 15 episodic care visits. And let's talk about our training. I mean, to me, like people don't understand that, at the best medical schools in the country, even right now, doctors are only trained on either medicine or surgery or procedures for your medical condition.
Yeah, they're not trained in systems. Like we were talking about earlier, they're definitely not trained in nutrition. What I've noticed is that they're trained to basically diagnose and treat, diagnose and treat, diagnose and treat.
Yeah, body parts.
Yeah, it doesn't make any sense to us because you and I are learning functional medicine, and it's much deeper than just, oh, I have high blood pressure. Well, why do you have high blood pressure? What else is going wrong? How can we fix that? But the typical standard diagnose and treat paradigm right now is you have high blood pressure, I give you these pills, and you take these pills for the rest of your life.
Well, and the thing is, think about it. Think about the deeper levels that we know now about even high blood pressure or diabetes, right? We know that it has everything to do with the food that you're eating,
Mm-hmm.
the toxins in your environment, the bacteria that's in your gut, the vitamins and nutrients that you're not getting from the shitty food you're eating.
Yep.
Right? And it plays into the genetics you were born with.
Yeah.
And how it manifests in you. So one person can have this problem and another person doesn't in the same environment because now there's a huge genetic component.
Yeah, it's even deeper than that. It's the epigenetics. Twins will have the same genes basically, but what one twin ingests or is exposed to, and the other isn't, there'll be completely different outcomes.
Well, we know that because we know that even, for example, let's say two genes, both twins have the deficiency of a gene to break down a toxin like arsenic. Okay. And they eat a lot of rice. Rice naturally is kind of high in arsenic. So let's say they eat a lot of rice. Both of them do. Right. But one person is, we were talking about even if they ate the same thing, right? That can happen. But let's say it's in an environment where one twin lives in an area where the well water has a lot more arsenic than the other. Boom. One has fibromyalgia and the other doesn't. One has cancer and the other one doesn't.
Yep.
And you could even look at the diet. Like one person could eat a lot of rice and then the other person doesn't eat a lot of rice. They have the same genes. Why is one sick and not the other? Is because they have no idea that the healthy brown rice that one of them is eating a lot of could be increasing the arsenic load in conjunction with the well water they're drinking, right? So these are complex problems and we need time to be able to talk to patients about. Patients need to learn a lot of this stuff. So that's not just random 1,000 pieces of information. And here's the clinic model that I think is really an issue. So think about this. Think about how in the clinic model, right, we even naturopaths and functional medicine physicians, even if you got to spend an hour with a client every 6 weeks for, let's say, 6 months, that's still like 4 visits, right? Now, what we just talked about with the diet, with the genetics, with the vitamins and minerals, with their gut, just those 4 things, how is any patient or client supposed to learn anything about that in 4 hours over 6 months in the best of care that we have right now?
You can't. It's impossible.
And how's even doctors learning how to deliver that kind of care that involves so many of these pieces, trying to do it in just 4 single 1-hour visits over a 6-month period?
Well, I don't know. Ideally, you would like the patients to take some accountability and do some learning. You give them handouts. The Institute for Functional Medicine has, 1,000 pages of handouts? Is that what you calculated it at?
Yeah.
About 1,000 pages. And, you can hand these out to the patients, but a lot of people can't understand what they're reading. Their medical acumen is low.
Which is why I think this is a great topic. We're talking about why the clinic setting fails chronic diseases, right? Mm-hmm. This is why even with the best of functional medicine, naturopathic medicine, and even with hour-long visits with clients, there's financial constraints of them paying for that, insurance not compensating for that, first of all. Second of all, even in those visits, how can in 4 visits over 6 months, we teach all those concepts to each person, right? So I think there's a healthcare revolution coming. I think there is an entirely different way to actually deliver healthcare and health outcomes by creating online formats and group coaching to actually train people themselves on learning these topics and how it applies to them.
That sounds great.
But think about that. Like if you have a diabetic patient in your clinic, I mean, you're seeing them in the ER right now, but if you have a diabetic patient right now with neuropathy, let's say, I mean, you would love to talk to them about diet, about vitamin deficiencies, about the role of hormones, right? Maybe just even teaching them about one vitamin like B12, right? How much can you say in the ER setting or in the clinic setting to educate the patient even just about the role of B12 or B vitamins or methylation in neuropathy?
You can't. That's a whole hour-long visit right there.
That's an hour-long video or 30-minute video that could be part of a program for diabetics that they can watch because it applies to them. Oh, you're a diabetic with neuropathy? You're in an online diabetic program, and there's an exact video about the role of diabetic neuropathy, how your diet, how these nutrients, how these specific vitamins can cause neuropathy, and how you can test it, what those numbers mean, and how to turn it around. What would that do?
It could help a lot of people.
I know. I mean,
Yeah.
that's what I'm talking about. That's what we're doing with our online program. And that's why we see results that nobody has seen in autoimmune diseases. Because if you have for us, we have an entire online program, right, for autoimmunity, right? And diabetes, a lot of people don't even know it's an autoimmune disease. But what if you're a diabetic in our program, specifically on our calls, you're like, I have neuropathy. I'm like, that's that bonus video you got to watch right now. That video's already there. We've already done the training. We've already done this. They already have seen the case. They can learn it and they can even look at their own lab values and be like, oh, this is why I can't use just B12. This is why I can use these other values.
And they
Oh,
can
this
do
is
it on their own time at home in the comfort of their own
right.
home. Yeah.
Right. So
It's
for me, I think there's just a lot of challenges in how we can teach. I think clients need to learn more themselves and have more accountability. But how can we do that if we don't have enough face time with them? And even if we have some face time with them, we don't have the capacity for every single one of our diabetic patients, even in an hour, to give these lectures over and over again all day long.
yeah, there's not enough time in the day for people.
I mean, I think about what are some ideal models or alternative models to deliver care to really teach people more of a root cause approach to these problems that are complex. And that's why, for me, I mean, this is why, to me, the failure of clinical and conventional medicine is exactly why I practice functional medicine now in an online format and no longer in a clinic one-on-one format.
Yeah, it makes sense. Let's talk about your background before you went into med school. Did you come into um, becoming a doctor? Is that something you want to do as a child, or is like, give us a little background of you?
So I grew up in an Asian household where the only choice when you grew up was you were going to be a doctor, a lawyer, an IT specialist, maybe an accountant if you're. It's really interesting is that, you know, in Asian families where education is huge, and it was like you were going to be one of these four careers. Luckily for me, I worked a lot in the medical setting because my parents owned a little coffee shop and under a medical building. So I was able to volunteer and then work during all my younger years. In high school, I was a medical transcriptionist for a neurologist. I was a file clerk for an OBGYN. You know, my sister worked for dentists in the area, helping to manage their office and work for them. We did a lot of work in the summer, weekends, evenings, with the medical community. So I just learned a lot. And I knew right away for me, it was something that, you know, despite me being as rebellious as I am, you know, I'm really rebellious.
Mm-hmm.
I knew that was something I really wanted to do. Was actually I think without health in our lives, we have zero wealth. So to me, the number one most important thing that we should spend our time in and invest our energy into is actually getting better health. And that's what I saw over and over again, even from a very young age. There's a lot of sick people really suffering a lot, and seeing that there's a unique opportunity with doctors, dentists, psychiatrists, psychologists that I was working with, that they were able to actually intervene and create results in people in a way that most of us don't have a chance to do.
Yeah, I mean, definitely health is the first wealth, and unfortunately, our society is very, very ill in every aspect. So you saw this and you were driven to go to med school, and then you went to traditional med school route and then went into internal medicine, right? Or
Family
family
medicine.
medicine. Okay. And then what?
Well, I went to family medicine. I mean, it was interesting. I mean, in residency, I loved everything. And that's why I actually decided to go into family medicine. because I never wanted to be just looking at someone's kidneys all day long.
Mm-hmm.
No offense to kidneys, but I really wanted to be able to actually, from the very beginning, I thought I really wanted to see people as whole people. And so I went into family medicine, and the first 8 years I practiced as a traditional family medicine doctor and I did everything. I mean, that we're learning now that is very limiting in factory medicine. I prescribed every single medication I was told to prescribe for every single Band-Aid symptom. That's exactly what we're trained to do. And every time a tired 40, 50-year-old male or female came in where all the labs were normal, I rolled my eyes just like all my colleagues did and be like, another one of those people that we can't do anything about. That we start saying, hey, maybe you need an antidepressant for, right?
Yeah, and that helped, right?
Well, that didn't help me when I became one of them. This is the shittiest thing is that after the birth of my first child and then the second child, I started to get these really vague but severe symptoms. I got really bad brain fog. I was losing my hair. I was losing weight. I was losing my mind. I mean, I got severe depression, anxiety postpartum, and I gained weight. I couldn't drop it. I almost became paranoid and obsessive in this worry spiral. And I started to feel like I was losing my mind over the course of the next, 4 or 5 years until age 36. I hit a brick wall and I hit early menopause at the age of 36. Boom. Full stop. And I went to my traditional doctors that I was one of them on, and I got my FSH 80. They're like, oh, Maggie, you're in early menopause. I'm like, why is it happening? And they're like, it's because you're getting older.
At 36.
I was really old at 36, apparently.
Apparently, yes.
But here's the beauty of this is that, the horror of it is that as a result of all those symptoms, getting no help. I mean, I went to gynecologists. I went to my colleagues' friends, and they told me, Maggie, you just need to get on birth control pills. You need to get on antidepressants, right? And you need this prescription for this symptom and that symptom. Between all these prescriptions, I got fatter, sicker, and meaner. Again,
Band-Aid medicine doesn't help.
Well, that's the medicine we have been doing for 10 years prior to that, Robert, right? So I realized, at the rate things were going, I mean, I was functioning worse and worse at my job. My relationships were breaking down. I ended up getting a divorce and I lost my job.
Sounds miserable.
It was terrible. I hit a brick wall. And so for me, like, I literally was in the fight of my life, financial dire straits, family dire straits, young children. And I had to really like reevaluate and really be like, okay, none of these doctors can help me. I can't even help myself. I already know what they're going to tell me. Nothing, and every single treatment they gave me that I would prescribe made me sicker. So I said, forget about this. And I hit a wall and I went and I looked everywhere else. I looked at alternative medicine. I looked at hormone balancing, bioidentical hormones, research. I looked at herbs. I looked at acupuncture. You name it, I tried it. And that was my journey. And when I started to apply these changes, learning about diet, nutrition, fighting to get autoimmune testing to figure out I actually had an autoimmune disease, and then having them say, so what? Right? But as I got better, guess what? My dead ovaries came back. I came out of menopause at 38. With an FSH of 80, I came out of menopause at 38. Have you ever heard of that?
Never. No.
I'm a walking grandma miracle, right?
Yeah.
But it's not. What it was I really realized was there are causes, deeper causes, that we're completely missing the boat. So I realized that this shit worked.
So what was it that you found worked for you? I mean, what was the causative factor? What was the root cause? And how did you change it?
The root cause was genetically. I had autoimmune disease in my family I didn't even know about, right? And I had the gene for it. Without knowing it, I was exposing myself to food, toxins, lifestyle that caused these genes to turn on. And then hormonally, after I delivered these kids, the hormone drops and fluxes turn the gene on even further. It's a very vulnerable time in women's lives and men in their 40s and 50s. There's such a thing as menopause. So all these genetics combining with the hormonally vulnerable times, combined with poor diet and toxicity, caused this to happen. And when I was able to turn it around and recognize it by changing my diet first, I went gluten-free. I figured out there was accurate testing to figure out what foods were triggering my autoimmunity. I avoided those foods. I looked at and measured my hormones and learned what the hormone imbalances that trigger autoimmunity. In my case, it was estrogen dominance and no hormones. It was first no hormones, and then later on estrogen dominance when my hormones came back. These patterns really trigger autoimmune disease and attack. They cause people literally feel like they're the walking dead. And once I learned how to balance the hormones with diet, herbs, I took some bioidentical hormones for a short period of time. And then after that, I was done. I didn't need any more because guess what? I came out of menopause. Literally, my life came back over the next 18 to 24 months because I figured out what was causing it and I addressed it one by one by one. And now I realize you can actually address it all together for people. And that's what I did for the next 10 years. I mean, how can you get better from that and then not go back to saying, oh, here's Prilosec for your heartburn?
Yeah, exactly. So it's funny that you mentioned estrogen dominance because unfortunately the majority of people in this country right now are, even males, are becoming estrogen dominance because of all the plastics in our food. If you check our blood levels, there's actually chemicals from plastic in every one of our blood.
Oh yeah, I have my report right here. I mean, you should see the plastics that I have found a couple years ago in my own blood.
Yeah.
Right. So, and I actually teach people how to actually understand these reports that are like stacks and tacks and pages.
Yeah.
You know, like doctors don't even know how to interpret these tests because there's such big panels, but I love teaching our clients actually how to understand that. But that's a whole topic, another topic, which is what is the role of estrogen dominance? What is the plague of estrogen dominance for men and women in this country? Why is this bringing autoimmune and chronic disease hell in this world?
Yeah, it's really wreaking havoc in many, many people.
And it's not just their hormones, it's all the xenoestrogens. So that would be a great topic at another time for us to really go into, is the role of estrogen dominance is terrifying.
Yeah, and the fact that estrogen dominance predisposes you to increased risk of cancer. I mean, it's a huge, huge cancer risk, which,
no, in fact.
And look around and where people are wondering, why is there so much cancer going on? And it's of course it's multifactorial, but that's a big part of it. My wife used to work she's in clinical research, and she was working with a OBGYN, and he would give talks. He was a OBGYN surgeon and oncology surgeon, and he would give talks and say being overweight, and he was flat out, not rude, but he's saying being fat and obese will cause you to have cancer and you will die from it.
Yeah, because all the toxins are stored in your fat.
And the fat cells produce estrogen as well.
That's correct.
And he would talk about how, the estrogen and the being overweight is really, really bad for you and dangerous. And it goes for men as well. Estrogen causes colon cancer, breast cancer, prostate cancer, uterine cancer, and lung cancer. It's not just breast cancer, and men get breast cancer too. So it's a real shame that the people don't have an idea how really sick they are, actually.
Well, but that's why, to me, this whole educational format is really important. Like what you and I are talking about, 99% of MDs out there don't even know this shit.
I know, it's crazy. And 99% of the MDs and DOs out there say, oh, you have this, take this pill. You have this, take this pill. And in
many cases, their pills are causing the cancer.
Yeah. Yep.
I mean, look at what we're seeing with all these medications that are for autoimmunity, for gut. We're giving kids with hives methotrexate.
Awesome.
What the hell?
Yeah, not good.
That makes me so mad. It's maddening.
Let's go back again. Let's circle back. So you went through. You did residency. You were a family practitioner. You had an autoimmune disease basically interrupt and pretty much destroy your life. And so then you decided, screw this, I'm going to go into functional medicine. How did you find functional medicine?
Well, first of all, functional medicine to me is a root cause approach to chronic disease. So what you're looking at is what are all the reasons that are underlying some symptom that you're seeing. So it really requires a thoughtful, scientific, thorough approach involving the patient, their history, their story, and diet. It's a very well-rounded evaluation of people so that you can identify what the cause is. And once you do, you can fix it. So you literally imagine like a tree, instead of looking at an apple with a black spot and saying, I got to spray you with the black spot, you literally looking at the soil and the branch and say, what's the problem there? Is there a problem in the soil? Is there a toxin in the soil? Is there a viral infection on this branch we got to deal with? And once you do that, guess what? All the freaking apples, every single symptom and target in your body can get better when you deal with the branch, the roots, and the soil. Makes sense, right?
Absolutely.
How I came upon it was that it didn't exist. I mean, if you think when I was 36, I'm turning 50 this year. 14, 15 years ago, functional medicine really didn't exist.
Yeah, there was no term functional medicine then.
There wasn't even a term then. So I had to go and learn from naturopaths. I had all the seminars that naturopaths went to. I hired naturopaths into my clinic. I opened a functional medicine clinic, and we had a naturopathic medical director, Dr. Carrie Jones. She's an incredible expert in hormones and speaks for Dutch right now. But she really trained all of us. So we had half regular allopathic conventional providers. Half of the clinic were actually naturopathic providers. We literally taught each other everything that we knew over the course of the next 8 years. We literally had to build our own program to teach functional medicine because there was at that time no formal training in functional medicine.
Yeah, it's sad.
But I created it in our environment, in our clinic in that way. But I will tell you though, I mean, that was a great way to go get into it. And we were a functional medicine clinic for 8 years. But I can tell you that what's killing a lot of these practices is that insurance companies are not willing to pay for root cause medicine. They're not willing to pay for longer visits. They're not willing to pay for these testings that are going to be that are going to be basically identifying these root causes. So a lot of these tests were, have to be out of pocket. And it's really hard as a conventional clinic or a mixed clinic to be like, I'm trying to bill your insurance for this, but insurance won't pay for that. People got pissed. But it's like, it's not, I mean, we're trying to do the best we can, but at the same time, there's a lack of understanding out there in the general public that this costs money to learn. I mean, I myself have spent over $1 million over the last 14 years to learn all about functional medicine, keep up my licensure, and continue learning and development. This year alone, I've spent over $100,000 in my own education.
Wow.
This year alone. So people don't realize that the kind of education that we need to keep going and to do this is huge. And we're dealing with an insurance environment where we cannot get compensated for the care, the better quality care that we give. And they're shooting the messengers. Literally, they're shooting the messengers.
Yes.
After 8 years of struggling in the clinic setting, financially being able to survive to deliver this better care, I had to leave it.
So what did you do then?
2 years ago, I started an online program, which is, for me, it was actually a side hustle where I thought, hey, I'm going to develop something online where I could actually create videos and trainings so I could refer people to it instead of teaching all this stuff over and over again in clinic. And that was the idea that started it. Once I started developing some of this, I was like, there's a whole structure, and we developed a whole online autoimmune program because I attracted the biggest autoimmune population was being seen in our clinic. And so we had a huge autoimmune population. So I developed an online program that said, hey, in a 2-month period of time, you're going to go through all these different modules that are going to train you. There's data involved, and you're going to learn what to do with this data. And every single week, you're going to meet online with us as a team in a group setting to hyper learn this shit super fast, so that you could get everything seriously, what we do in 2 months with people on our program, people sometimes require 2 years working with a functional medicine clinic self-pay to get, but we do it in 2 months for people. And people don't realize, functional medicine is not paid for by insurance. If you saw a functional medicine doc for 2 years to get all this done, it's going to cost you $20,000 to $50,000. Thank you very much.
Yep.
You know this.
Cash only, baby.
Well, because insurance won't pay for it.
Yeah, it's sad. And insurance doesn't they decide to pay for traditional conventional medicine that is just filling the big pharma's pockets.
Right.
And it doesn't pay for us to, study hormones or study, stool analysis or, hormone studies in urine and things like that, dried urine hormones.
And then have your patient mad at you that they had to pay for it.
Yeah.
Have a patient mad at you that you spent an hour reviewing those results with them and that you actually have to bill them for that time because their insurance company won't pay for it.
Yep.
So that's very frustrating for a lot of us functional medicine doctors who are doing this kind of deep dive and really caring and looking at people deeply. It's like I found that in the clinic setting, working with autoimmune clients, it took me a good year to 2 to really get all these pieces together. And I said, there has to be a better way. So we do all of that now in 2 months in an online program that really kickstarts people to a year of their own autoimmune turnaround.
And assuming you're seeing good results?
Crazy results. We have never had results like we have since we've turned it into an online program. If you go to our Facebook group, which is Transform Autoimmune Disease Naturally, if you go to our Facebook page, Dr. Maggie Yu, just Google my name and go to our Facebook page, there's literally over 60 client case studies and interviews right now of people who have literally, I have Tyler who's dying from Crohn's, literally on his deathbed, who right now is, going crazy with his life and his young children. We have people who we just had an interview last week with Dawn and her 12-year-old daughter, Kendra, and she has deep morphia, scleroderma, which her dermatologist said has never seen one case of remission. In 4 months' time, had remission.
Wow.
Their doctor wants my information so she can send all her clients over. But I see this every single day.
So real quick, how do you, is it a HIPAA violation to talk about people's names?
No. Because what it is you have to understand is we're in an online coaching program. I'm not their doctor. I'm coaching groups of people in an educational format. And these clients are perfectly happy to talk about their own experiences. We don't have to even solicit. We talk to our clients and our clients are like, I want to tell my story to share with other people to be an inspiration to them. Many people, even regular doctors have patients go on and record interviews and patients can decide whether they want to give their full name or not to be interviewed. You've seen that. So no, it's not a HIPAA violation.
Okay.
In fact, people can't wait to actually share their success. We have so many great successes that people they're starting to believe, they're like, is this even real that there can be this many people that get this much better all the time? Because we have an interview every single week of something like this.
And you're not just doing what standard rheumatologists do. Okay, you have this scleroderma, take these pills. You're doing something completely different with these patients, which we touched on earlier. Diet, lifestyle, epigenetics, so on and so forth, toxin burden, so on and so forth. Right?
Absolutely. And I feel that in an online format, in a group setting, we're able to actually educate a group of people through that process, that 2-month journey, to really launch them into a year of really turning things around. So for me, what we do is we look at all these different pieces. I actually have an online training. So if people want to go to drmaggie.com. There's actually a free training you can go to where I actually go through and I say, here are the 5 areas that you really have to focus on to get this turned around. And look out there. There's no one working with anyone that says, I can take you through that journey in 2 months.
Mm-hmm.
Right? So it's really talking about hormones. It's really talking about vitamin nutrient deficiencies. It's talking about diet. It's talking about gut health. It's talking about food mapping, how to use data to identify which foods is triggering the autoimmunity, right? And I didn't even touch on this, is nobody in healthcare right now is fully working with patients on what is going on with their brain. Can we change patterns of thinking so that their brain is actually wiring their vagus nerve in their body towards healing? Yes, we can. So the mindset work and the coaching that we do to change how people think is perhaps the most powerful secret weapon of all that people don't even talk about. They don't even know. Even coming into the program, they don't even know that that's the secret sauce.
Yeah. I tell people that, personally, this is my humble opinion, that I truly think that the human brain is the most powerful thing in the universe.
You know
it
that.
can cure your body. Just the thoughts. I mean, placebos. I mean, even when people are told, hey, this is a placebo, but we want it to cure this, placebos work. Even when you're told it's a placebo. And the whole schema, like what you're talking about, rewiring your brain, a schema, people, for some reason, they have these bad schemas that they play over and over and over in their brain. I'm sick, I'm tired. Well, you change that schema around and you tell yourself, I'm gonna heal, I'm healing, I'm getting better.
That's exactly what we do. For example, I tell people that focus is what you focus on grows.
Mm-hmm.
So 99% of sick people focus on what's going wrong and what else is going to go wrong. Seriously, you get out of bed and you're like, what else is going to go wrong today? What do you think you're going to manifest? Focus is power. What you focus on grows. So one of the biggest things, earliest things we do in our program, everybody in my program is going to tell you, is we focus on wins and celebrations. Before every weekly coaching call, at the beginning, we say, what are your wins? What are your wins? What are your wins? What are your wins? And what we found is that when people start shifting and they start focusing on the wins, they start looking for what's going right. They're changing their focus and they're manifesting more and more and more stuff going right. This is beyond placebo. Placebo already, we know, works just as good as many medicines. But imagine beyond placebo, changing your thought pattern to say, what are you going to manifest every day? What are you looking forward to that's a win every day? How powerful do you think that is?
Yeah, it works. It absolutely 100% works. Like I said, the human brain, in my opinion, is the most powerful thing in the universe that we know of. It's more powerful than any computer, period. So you started this program now, and you and I had talked about this before at the conference, and you use the term clients, and so you don't have a patient-doctor relationship with your patients, correct?
That's correct. I am not their individual doctor, and I'm so glad I'm not, because then I'd be limited, right?
Uh-huh.
Because what happens is that when you think about a doctor-patient relationship, it implies a one-on-one, all this secrecy, all this huddle in the corner with this one client, one patient, and the other patient. Now, here's the thing is, if I'm in a group coaching environment where I'm not their doctor, I'm literally a teacher teaching them some skills. Teaching a group how to look at labs, teaching a group how to eat better, right? I don't have to hide in secrecy one-on-one with each client, because if I tell you something genius, Robert, the other 10 people on the call are going to learn from that genius thing I just told you, Robert.
Yeah.
Right?
Yep.
It's not like I told you, oh my God, this mind blow about how estrogen can recirculate from your poop back into your body, right? And that's terrible. You didn't just learn it from me. The other 10 people on the call also learned it.
Yeah, that makes sense. And then Dr. Mark Holthaus, who I'm hoping to have on this podcast later, he's doing the same thing, but he's doing it in a little different clinic setting, like he talked about. They're actually doing group
in person?
Yeah, in-person groups
Yes.
in his clinic. And he's saying that one of the reasons that he's doing this, and you and I spoke about this before, is that when we're one-on-one, I mean, we can only see 8 patients a day. But if you can get a group of 16 people in one day, and you can run that group 4 or 5 times through, you could see 90 people, 100 people, and change 100 people's lives in one day.
Absolutely.
Versus, 8 people. So
that is the mind-blowing truth of doing one-to-many is that I can tell Robert, you one piece of gold, and 16 other people just got that piece of gold. And then, and I can do that in an hour with you, Robert. And in the next hour, I could be in another group of 16 people. I mean, how many people, how big is that cascade? And these 16 people are in a community together, going through the program over the 2 months, supporting each other on Facebook, talking to each other, posting their pictures, posting their wins, celebrating, building a community together. How powerful is that versus you huddled in the corner with your doctor one-on-one once every 6 weeks for 4 months or even a year or 10 years?
Yeah, it's infinitely better. And we can affect and help more people almost immediately with the group approach. I think I've never done it personally, but I see the benefit of it, and I kind of want to do it because I think it's going to be fantastic, and especially using the internet like you're doing. I mean, you're talking to people from Australia and other countries, right?
So yeah, we're talking to people in Australia. Here's the thing is, because we're teachers teaching,
Mm-hmm.
it doesn't matter someone's in Australia or the UK or, Canada. We have tons of clients from Australia. We're a functional medicine or natural medicine. There's almost a witch hunt going on with some of the MDs in Australia, being like government persecuted. There's certain countries where it's really difficult to access training and delivery of natural medical care. So then those clients themselves are enrolling in our program, say, I want to learn from somebody else somewhere in the world. I'm just signing up for a learning program.
That is so sad. And it's actually occurring here in this country as well. Google, it has been shown, and Facebook, they are eliminating functional and naturopathic natural medicines and anti-vaccine posts and information, which unfortunately is not, regardless of your take on vaccines, it doesn't matter. But people should have the right to hear both sides to every story. And whether you like vaccines or not, it doesn't matter. But
for people who are listening to this, if you're interested in a deeper discussion about vaccines, I did a podcast with Dr. Paul Thomas, and he wrote a book that's completely scientifically researched on, called the Vaccine Friendly Plan, about a reasonable approach to vaccination. Okay, based on data. That's
can you
not
say
an anti.
Yeah, can you say the name again, please?
Dr. Paul Thomas wrote a book called The Vaccine Friendly Plan that's 100% backed by research.
Okay, good.
That is not an anti-vaxxer. That is vaccine education. Okay, and yet he's being labeled politically as an anti-vaxxer, and Facebook is censoring any groups and any pages that's disseminating anti-vax information. His book, and he is 100% backed by research. So why has Facebook, Google, or whoever the hell it is decide that they are now going to decide what they're going to label as truth and not? Since when did health, like vaccine and scientific research around it, become a political issue rather than a health issue?
Yeah. And it's my opinion that people have a right to decide what's put into their body, and there's never an appropriate time to censor information, period, hands down. It doesn't matter. So it's weird, the whole Facebook thing. And like, I'm surprised because YouTube is owned by Google, and there's a lot of things on YouTube that you could still search, but Google will censor it. It kind of baffles my mind. I'm surprised. What about you? Like, with your Facebook group, is there any issues there?
We have actually one of the largest Facebook groups on the planet for autoimmunity, and it's Transform Autoimmune Disease Naturally with Dr. Maggie Yu. And we're at 20,000 members right now. And and what we have found is that, as long as we don't talk about vaccines, it's fine.
That's funny. Yeah. Okay.
And it's not me talking about it. We have so many members making posts, and they'll post a vaccine post to just start a discussion. We actually have to moderate and decline the post, and we have to tell them, per Facebook policies, we can't even do it, because what happens is Facebook can shut us down or stop our group from being found in searches if we are found to disseminate that. So then we actually have very kindly let them know that it's not our issue. Facebook won't let us post this without penalizing or destroying or shutting down a group.
It's kind of scary how powerful Google and Facebook have become.
Yeah.
Really.
In fact, if you post this, I'll tell you right now, if you post this interview on Facebook, they have automatically be able to transcribe this. They can pick out that we're talking about vaccines, and it's in the future, it's coming, where they can actually they can label sites and videos and be like, oh, we deem this as anti-vax, whatever, because they can computer auto-generate the transcripts.
Wow.
Yeah.
Wow, interesting.
Yeah.
So let's think, what else? I got some questions here. What's the most profound lesson you have learned while practicing medicine?
I can't care more than you do.
It's funny you say that, because I was talking with a firefighter today about that, and I said it's impossible to care more about a patient than they care about themselves.
That is absolutely right, which is also why I'm in an online program. I'm going to make this really is an interesting conversation because what I found was when I was working in a conventional clinic and trying to apply functional medicine principles, I was like almost begging and teaching and trying to convince people to like care about their diet and care about the fact that they have this long family history of cancer and they're at super high risk. And I would say 99% of people just really don't care that much in that they want it the easy way, right? And they still want a pill. It's not just, a lot of people still just want a pill and they're in a system that's designed to teach them that's all there is, right? I mean, it's chicken and the egg, right? It's both. So one of the most important things for me is our company is very specific about who we choose to work with. We do not take all comers. In fact, we have about 150 people a month reach out to us who want to join our program. We only take on maybe 15, 20 at most, because I really want to choose to work with people who are like, I'm ready to kick ass, take names, and chew bubblegum.
And how do you suss out the right ones versus the ones you have to decline?
We have to talk to people. So people don't just come on, go to drmaggie.com, click a link and say, I want to buy your program. It doesn't work like that. To me, it's a relationship I'm going to be in with this client for the next 2 months. And over the next, year, I'm going to watch how they're going to progress too in our community. And so for me, we have an application process. We have real people talking to people and their family members to screen them to make sure they're the ideal candidates to benefit, to really do the work, that they truly care just as much, if not more than we do. That's why we get such crazy ass outcomes. We choose very carefully who we work with, because what's the point of like someone who's like, oh, I want to buy this program, but I just want you to tell me what supplements I need to take. And I'm not willing to do all these other things that I need to really have true transformation. That's a waste of their time and ours, frankly, and their money and our effort.
Yeah. It is for sure. And you got to get people to buy in. It has to be buy-in. And, very few people know that the term physician means teacher. And that's all we're doing. That's all we're doing to patients is teaching them, sharing our knowledge with what we've learned. And, I tell people all the time, I'm talking about food. I see what they're eating and I tell them, that's poison. You're eating poison right now. This is killing you. And they're like, well, whatever. I don't care. So I know exactly what you're talking about, the buy-in. And you have to suss out who's going to be a good fit for your program and who's not.
Yeah, I don't want to work with 150 people. I mean, I do if they're all people who really care just as much, if not more than I do. I'd rather work with the 15 to 20 who says, I am doing everything. This is the fight for my life. Teach me. I'm hungry for this result. I will do anything and everything. That's why we get like 50, 60 case studies of people who like literally on death's bed who are like now walking, exercising, taking their kids on camping trips. This is how it happens, is also choosing very intentionally who I'm going to spend my mental real estate working with, and who has the ability and the capacity to benefit from that.
Yeah, you said it well, that it's the fight for your life. This is the biggest fight of humans. The biggest thing that we need to fight for our health. And if you're not willing to fight for it, then you're going to pay for it. You are going to suffer the consequences if you don't say, hey, I need to change my diet. I need to change my lifestyle. I need to change my way of thinking. I need to change what I watch on TV. I got an idea. How about quit watching TV? But you have to, it's the biggest fight of our lives, our health.
But think about this. You pay anyway. So let's say people say, oh, I'm too poor to eat good food, which we already know isn't true. You can eat on a budget with great food, period. Right? But they say, I'm too poor to eat good food. So they're eating all this crappy food and it's supposedly cheaper, right? But think about that over the next 10, 15, 20 years. How much medical bills? How much lost time off work? How many deaths in your family? How many cancer and strokes and heart attacks? What is the financial toll of that? Are you going to pay less now and just pay more when you're 50 years old, your first heart attack?
Yeah, what I tell these people is if you think being healthy is expensive, try being sick. And boy, oh boy, do people get it then, especially when they go and spend, a week in the hospital and, they get a bill, but the insurance is paying for it and their bill's $67,000. Wow, who's got an extra 50, 60 grand laying around to just spend a week in the hospital? Not me.
And you're spending that 67 grand not even to get well. You're to like change the future of it. You're doing that 67 grand as a band-aid to deal with that acute situation, near-death experience, only to come out to continue that same track. What did that 67 grand really do for you long run? Nothing.
Nothing. Yeah. And then another thing too, I have some people I work with, and they smoke cigarettes and they drink Pepsi and eat garbage. And I'm like, dude, you gotta fight for your health, man. And he's like, well, I'm happier smoking, or I'll be unhappy if I stop. I said, man, you have that choice to be either happy or unhappy, whether you're doing smoking or not. And people it's weird how people can't see that, limiting things from your life like smoking and other bad foods and bad habits, you can be happy without those just by choosing to be happy without them. It's crazy.
We have actual extreme choice, but the problem is we're not educating people so that they're actually motivated and informed on making those decisions.
Yeah.
So they don't even have the education necessary to make informed choice. They're literally like pigs brought to the slaughter.
Yeah.
Brainwashed in the same thing over and over again. But there's simple things. People can just, even drinking more water. I have, for the start of my program, we have a 10-day water challenge where we challenge people. We teach them how to calculate the ideal amount of water they need to drink. And we actually show through their posts in Facebook what transformation happens in the first 10 days of just drinking the adequate amount of water. People's pain levels going down, mood is improving, brain fog is gone, weight is lost. This is just drinking water, Robert. That's it.
How do you calculate the ideal amount of water?
So you take your body weight in pounds and you cut it by half.
Okay.
And then what I do is if you're 150 pounds, it's 75 ounces, right? But what I tell people is if you do any sort of exercise, that's 30 minutes, or, for every 30 minutes of exercise, you want to add vigorous exercise, add about 8 ounces. For every caffeinated beverage, which you should wean down anyway, but if you're going to have coffee, I don't count green tea because green tea has so many health benefits, but coffee specifically because it's high caffeine. I tell people that for every cup of coffee that you drink, it's just a minus that ounce. So you drink 12 ounces of coffee, you're minus 12 ounces from your 75. So you, instead of 75, you have to do 87 ounces. For every 12 ounces of coffee that you drink, you have to add on that amount to make up for it because coffee makes you pee it out. Mm-hmm. You lose water for every cup of coffee that you drink. So we have a 10-day water challenge in our program, and you should see the transformation within the first 10 days just from people drinking water.
Well, it's like a house plant. When it's droopy, looks like it's going to die. If you just add water to it, what happens? It bounces back, looks beautiful and glowing, and it's healthy.
Well, and you also think about it, if you actually just give a little bit of water every day versus giving like consistently throughout the day, slow drip, what happens is the plant grows deeper roots and it's able to retain more water and it's able to be healthier all the time. It doesn't wilt ever because it's had the ability to grow these deep roots. That's what daily drinking water throughout the day will do, is tap these deep roots for health.
Yep. And it goes back to functional medicine, the roots. Got to get the roots healthy, right?
Yes.
What do you consider to be your best medicine? What do you do to care for yourself?
I think the biggest thing for me is actually thinking about, I think it's balance, like consistency, actually. I mean, to me, I love Simon Sinek. And one of the things that he talks about is that if you consistently do something like if you brush your teeth, let's say you brush your teeth. The first day you brush your teeth, even once a day, twice a day, does anything happen? No, nothing, right? But even a week or a month, if you brush your teeth, does it do anything? But over 5 years, 10 years, a lifetime of brushing your teeth every day, what is that going to do? It's going to actually help with all your gum health. It's going to help with the bacterial population. It's going to help your smile. It's going to help with overall your ability to chew your food because you have good teeth, good tongue health, all this, right? It's consistency. And what I found the number one principle for me is if I consistently pick, let's say a habit, whatever it is, and I consistently do it every single day and make time for that consistency, the long-term benefit is huge. And so example is just drinking water. I consistently drink at least 80 ounces of water every single day. And what it's done for me, just drinking water every single day over the past, year has been that, that was a new habit for me to that amount. My skin is glowing so much more. People say I have really good skin. Well, it's not all genetics, guys. It's that I really do drink the water to hydrate. I've noticed my wrinkles are less, the puffiness under my eyes are less, the dark circles under my eyes are less, my energy, my ability to focus, my passion, my happiness factor, my power in delivering educational trainings. It's from water. But that's the consistency of doing one habit every single day. So how many consistent habits can you build in that are good for you over the next month, over the next 6 months, over the next 6 years?
Yeah, that's awesome. And pick the good habits for you. And, think about in the opposite realm, the consistency of smoking or eating donuts or doing things that are bad for you.
Right.
They build up and build up and build up. And over time, you're going to pay for it again.
I mean, I have just people like some of my clients are just when they have donuts at work, I'm not going to eat it. That's their habit. They say, I have some nuts. I have some fruit that I'm going to have every single day that I'm going to bring to work consistently every day, so that when they bring out the donuts, I'm not going to get it. I'm not going to go and get out the candy bowl. Think about the effect of that one habit change alone over the next year, 6 years, 10 years.
Yep, absolutely. It's funny because I get teased at work because amongst other doctors and healthcare providers and nurses, because I don't, there's oftentimes there's donuts at the nurse's station. I'm like, nope, I'm good. Thank you very much. I don't eat that stuff. And they're like, what? Or like instead of, eating the bagged snacks that they have in the office, I have my own mixed nuts, or I bring my own food every day, and I drink water. And it just baffles me that people continue to eat the garbage and the poison that is there.
And it's cheap and it's accessible. It's the sad American diet.
Yeah.
SAD, sad American diet. So for me, I don't buy into that. I'm not going to die like the rest of the sad American diet people. I'm not going to do that because I've seen my mom die from ALS and suffer. I've seen so many people suffer with the worst, most imaginable deaths. And that's from eating the sad American diet. I'm not going to be one of those cows left to the slaughter.
Me neither. And I've been healthy pretty much most of my life, and it doesn't take a whole lot of effort to choose health over convenience.
No, bring some nuts, man.
Convenience,
so hard.
Yeah, convenience is the killer. One of my nurses who's on our page at work, she's awesome. She lives in Truckee and she comes and works down here, and she said that to me one time. She said, Dr. Floyd, convenience is the killer, and she couldn't be more right. Yeah, it was really cool when she said that to me. So in your opinion, what are we doing right in healthcare today?
I think the biggest thing we're doing right in healthcare is actually the movement towards functional medicine and root cause medicine. There is a bunch of us rogue MDs and health providers who've been sick ourselves. I mean, you and I were at the conference at IFM, and when they asked how many percentage of the providers in here, and they're acupuncturists, nutritionists, how many percentage of you have had a major health scare or illness, and that's what drove you here? It was 99% of the damn room.
Yeah, there's a lot.
So there is what we're doing right is that unfortunately by our own illness and sickness and by our own experience of the failure of conventional medicine, there's literally a drive, a crusade actually with doctors and healthcare providers, professionals, that's leading the charge to educate ourselves and thus our patients to go deeper into the root cause of what's going on and changing our health from the root and main trunk up. That's what we're doing right.
Well, good. Excellent. So this could be an entirely other episode of a podcast. What do you think we're doing wrong, or what could be improved in healthcare?
I think we went over that ad nauseum.
Yeah.
So I'm going to skip that one because I feel like that's what we've talked about the entire podcast.
Well, two things. Just give me two things that you think could be improved in healthcare.
I think that educating, just bringing the idea of training our young doctors that it's not just medicine, procedures, or surgery, that there's the possibility to have curiosity, that there are other tools in your tool bag you could possibly have. Oh my God, pain, acupuncture. Oh my God, nutrition, more than 30 minutes in the 4 years of training that we got in medical school. I think that medical students and young doctors leading with curiosity would be huge, to demand better training tools for us so that they just know those are not your only tools, for God's sakes. There's literally hundreds of other tools out there that have some intro to it, have some curiosity about it. That could change the world, because that's what changed it for me once I got sick, was this inkling that there must be more out there.
Yeah, I've kind of always been in a searching mode. I'm always looking for something, and I've never sat back on my heels and said, okay, well, this is it. I'm always looking for something better. And, luckily I found functional medicine. I don't even remember how I came across it, but when I found it, I knew it was for me. It just was for me. And this is, to me, the wave of the future of medicine is root cause analysis. And so,
Robert, for me, when I found it, saved my life.
That's great. Yeah.
It saved my life and patients' lives, and it created a whole new career for me. Completely changed the trajectory of my career and my life.
Excellent. Yeah, and I got to meet you because of it. This is great. Speaking of career and trajectory, where do you see medicine in 25 to 50 years?
I think we're going to be, in 25, 50 years, we're literally on the first baby toddler stage. We're a newborn in functional medicine and root cause. What I think in 25 to 50 years is we're going to find that this was literally the beginning of looking at genetics. We can actually take SNPs from patients and look at their genetic profile and see, oh, you're at risk for A, B, C, and D because of this genetic predisposition. We already have that technology now. So imagine where that's going to be in 25 to 50 years once that's applied across the board to everyone, to say, so that we know what our risk factors are. I think that we're going to be able to scan food and look at food. There's going to be barcodes on food where we're going to be able to track and have some transparency, so that I think that we will know what the journey of your food was to your plate, so that you understand the risks of all the chemicals, toxins, and where this was grown. I think with the technologies is already there. Why can't we just start we'll, as consumers, we're going to have these tools, and there's going to be labeling and transparency in food, where I think there's going to be a lot of technology around it, so we can understand and track food better, and sourcing, like how we source everything. So I think between genetics and the ability to do further medical testing to link people to root cause, we can also track food better. I think that could be the beginning of like this whole movement towards changing root cause medicine.
I mean, let food be thy medicine, right?
Mm-hmm.
You got to have, food's got to be the medicine. So what pearl of medical wisdom can you leave our listeners today?
There's so many, but I would say that the most important thing is that you need to, as a person with chronic disease, I assume a lot of people watching have some health issues, is that I think the most important pearl I have is, it's not information you need. Everyone thinks like they're one Google, one book, one bad diet away from getting the answers to these complex health problems. And I'm going to call bullshit. We are not in an information lack age right now, where you can Google any question and get 20,000 answers to that question in 20 seconds. We are not lacking information here. What we're lacking in healthcare and people's health is integration, personalization and integration, meaning like which pieces of that information actually applies to me. There's so much generalized information that's personalized to no one, that's useless, right? What piece of that information applies to me, number one. And then number two is, how do I integrate all these pieces together and understand how they fit together to create a system, a foolproof strategy and system to kick any disease's ass, right? That requires integration, and that's what's lacking right now. Everyone thinks it's going to be the next miracle thing, next Google research, next supplement away. And I'm telling you, the doctors that are helping teach patients and clients on how to put all these pieces together, that is the next movement in the miraculous outcomes that we're going to see in health, is teaching patients how to integrate all these pieces together. And that requires an educational model.
Got to educate. Got to be educated. You can never be overeducated, period. So
there is no education in healthcare right now for people.
Yeah, and it goes back to, this is the biggest fight of our lives. People need to be educated about how to be healthy, but they're not. It's really sad.
Well, their doctors aren't, so how can they?
Yeah, but that's why we're doing this. And you asked me, what is the whole goal of this podcast, the Medicine Wheel that we're doing? The number one thing is to educate, illuminate, and inspire, and entertain. I mean, I think a lot of our podcasts are entertaining. They're not boring. a lot of information, a lot of education, fair amount of entertainment, but we're hoping that it's inspirational to get people to kick ass, take names, and leave debris. Don't let a disease demand and tell you who you are. You can educate yourself and get yourself better just by, like you said, educating, Googling. But, Google. Don't ever trust Dr. Google.
It's not information that you're lacking, people.
Yeah.
It's personalization and integration. That's the pearl.
And sometimes motivation. All right, excellent. So real quick, how can people get a hold of you? I know you said it a couple times. And
yeah.
So
if they go to drmaggieyu.com,
okay.
And I'm sure you'll list it underneath the podcast,
yep.
MAGGIEYU, just drmaggieyu.com. There's a free training that you can watch to learn about all these fundamental 5 pieces that are a root cause approach to autoimmune disease. Honestly, any disease, but autoimmunity. And then our Facebook group is Transform Autoimmune Disease Naturally. Just put that into Facebook and they'll lead you to our group and just click join. It's an incredible community and we have tons of alumni in there helping answer questions, point people to resources as well. And it's free.
Even better.
Yeah.
And do you have, if I remember correctly, you said you also have a podcast?
Yeah, on my website, drmaggieyu.com, we also have podcasts. So we've interviewed clients and a lot of clients, and so we have a podcast as well. And this interview will be adding to our podcast amount as well. So I have a podcast as well. We have a YouTube channel where you can watch some of our videos as well. So just look under my name for podcasts or YouTube, and you will find it.
Awesome. Excellent. Well, again, thank you so much for coming here today. It's a pleasure talking with you, and we'll have you back for sure, and we can discuss more of the things that we chatted about before the podcast. So,
you rock.
Awesome. Thank you so much, Maggie. Appreciate it.
Thanks.
And thank you for tuning in to the Medicine Wheel. Please remember to go and rate us, like us. If you don't like or don't want to rate us highly, please leave some constructive criticism how we can do better. And thank you very much. Here's to you. Here's to your health. Bye-bye.
The Medicine Wheel encourages all of our listeners to subscribe to our newsletter and podcasts as we continue to explore the world of medicine, bringing you up-to-date health and science information. The Medicine Wheel invites our listeners to email us any newsworthy stories or topics they wish to explore further and discuss on the podcast. For more information about the Medicine Wheel, please visit us at our website, www.themedicinewheel.org, and on Facebook, and finally on Twitter and Instagram at The MedWheel.
In an effort to support access to integrative medicine and functional medicine options for those in need and education for those who need information, please consider donating to Project OmCare, 501c3.org. Please go to our website, www.themedicinewheel.org, to learn more.
Thank you again to all our local sponsors, Grateful Gardens, Lighthouse Coffee, and Dorinda's Chocolates, which represent some of the best organic and appetizing options in the Reno, Tahoe area.
Lighthouse Coffee Shop is a proud sponsor of the Medicine Wheel. We are a family-owned and operated local coffee shop. Our goal as a business and a family is to cultivate community wherever we are. All of our coffee is ethically sourced, organic, and farm fresh. It's roasted in-house daily, guaranteeing you access to the freshest cup of coffee on the planet. We care deeply for our community and everyone in it. We strive to provide you with the best ingredients and most comfortable environment. Come and enjoy coffee with us. We are family, and we would love for you to be part of it.
Gerber Medical Clinic is proud to support the Medicine Wheel and medical education to improve health quality, nurturing the lifestyles of our listening community, enhancing wellness for all. Thanks again to Wired Insights and their talented team for making our podcasting dream possible.
In closing, we would like to remind all of our listeners, if you have a medical concern or diagnosis, you need to see your personal doctor without delay. and if needed, obtain a referral to a specialist. If ever you feel the health issue you have is urgent or an emergency, please call 911 and go to your nearest emergency room. Please do not take any of our physicians' commentary or our guests' opinion as medical advice, and always seek out medical care from fully licensed and appropriately trained medical professionals in your area. The information shared in this podcast is for general information only and should not be construed as medical advice, and understand that no doctor-patient relationship is formed. The use of this information and educational materials linked to this podcast and website are employed at the user's own risk. The content of this podcast is not meant to be used as a substitute for medical advice, diagnosis, or treatment.
This is the Medicine Wheel signing off for this week with a reminder to live, love, listen, and learn.